So I'll just introduce myself. My name is Tuana Salias. I'm a dietitian and I work for ABL Health, and I will be talking to you guys tonight about vitamin D and hopefully set the record straight about how things should be taken and what all about vitamin D. So hopefully we'll give you quite a few bits of information tonight. I just want to familiarize yourself with Zoom. Obviously, I can't see any of your faces. You should be able to see mine if you wanted to. Otherwise, you can have just a full screen of the slides that I'm going to show you. But there is an option where you can chat to me or answer or send me questions or answers, and we can go through that at the end. So you can just type it in. So at the bottom of your screen, there should be a cursor with a chat function and a question and answer function there. So if you wanted to ask me anything or by the end of the session, you can just put it in that chat function and I will try and get back to you or answer you the best I can. So I'll make a start. Thank you again for coming tonight and giving up some time to learn more about vitamin D, which I think is a really important topic as well. So I hope you enjoy it. So I'll make a start. Sorry if I'm looking away from the screens. I'm just making sure that everyone can hear me and that I can see who's coming in. So we've got a very good attendance tonight. So let's look a little bit more about vitamin D. So vitamin D is a fat-soluble vitamin. It's one of 4 fat-soluble vitamins that we have, and the others are vitamin A and E and K. So I don't know if you've heard about the acronym called ADEK. So A, D, E, and K is the 4 fat-soluble vitamins we get, and vitamin D is one of those. It's quite an essential vitamin in our bodies, and it covers quite a range of bodily functions that happens for us. So it is an important nutrient in our body. Vitamin D is seen as a nutrient because we can eat it, so we get it from food, but it's also a hormone, interesting enough, because our body can actually make vitamin D. And as you might have alluded to with the front slide, it can be made through sunlight and through the sun rays on our skin. So it's seen as a nutrient, but as well as a hormone. So vitamin D is actually an umbrella of different kinds of vitamins in vitamin D. So a group of compounds. You get vitamin D2 that can be made from plants, things like mushrooms or yeast. We also get vitamin D3 that comes from animal products like eggs, fish, cheese, and it's also the form of vitamin that gets absorbed by the sun. So when we have sunlight on our skin, we absorb vitamin D3 onto our skin. Calciferol, that's the form of vitamin D3 found in the bloodstream after your liver has converted vitamin D, so our bodies can actually use it. So those are the workable or usable form of vitamin D that we get inside our bodies. And calcitriol is the hormone form of vitamin D. So if it went through quite a lot of processes, then that's what you end up with. So just moving on. Sorry, there you go. So vitamin D plays sorry, I think I've skipped it. No, vitamin D plays an important role in our health. First of all, if we look at how our body absorbs and retain calcium and phosphorus to keep our bones healthy and our teeth healthy. So vitamin D plays a really important role in that process. It also plays a very big role in protecting our muscle strength and preventing diseases like rickets, osteomalacia, and falls. I will talk a little bit about this as we go through the presentation. So there's quite 2 good things that vitamin D in our health does already. It's been thought that vitamin D is seen as a pro-hormone because it's got so many bodily actions that it can do. And we are really still learning about things around vitamin D, believe it or not. So there's still quite a lot of studies and learning to be done about all the benefits of vitamin D. So what are the other benefits of vitamin D? So research suggests that nearly every cell in our body has receptors for vitamin D. So not surprisingly, it has a wide range of effects in our body. Many of the body's organs and tissues have receptors for this vitamin D, which suggests that it plays a very important role even beyond bone health, and scientists are actively investigating other possible functions for vitamin D. More research is needed about the role of vitamin D and the immune system, but there does seem to be a negative link between people who has vitamin D deficiency and the development of things like multiple sclerosis, type 1 diabetes, flu, and things like the common cold, tuberculosis or TB, and autoimmune diseases like rheumatoid arthritis. So although we can't say there's a direct link, we know that there's a negative connotation for people who has lower vitamin D levels. But let's look at optimum vitamin D levels and how they can support our bodies. It can really help with looking after our immune system. And I think for immune system, there's still a lot of research out there about how exactly it does do that. I don't know if you can recall through COVID, there was a big emphasis in, does people with COVID need additional vitamin D, or if you take additional vitamin D, can that stop COVID from happening? There wasn't actually concrete evidence to say that that is the case, although it does sort of feed into, is there a link with immune system and vitamin D? So watch this space for knowing a little bit more about that in the very near future. It does support healthy cell function because we already said vitamin D has a receptor in nearly every cell in our bodies. So if we've got adequate vitamin D, we know that our cell functions is working correctly. It plays a role in blood sugar regulation, and there is some evidence to say that optimum vitamin D in our bodies, so if we have really good vitamin D levels in our body, we do have a reduced risk of developing type 1 and type 2 diabetes. As said before, it's really important for bone health and muscle strength. And there's several studies linking low vitamin D blood levels to an increased risk of things like fractures, like breaking of bones, especially in older adults. So vitamin D may help increase muscle strength by preserving muscle fibers, and that's how it keeps us strong. Vitamin D is important for calcium absorption and circulation. It can actually play a role in normalizing our blood pressure, and therefore it plays an important role in decreasing people's risk of having a heart attack or stroke as well. There's a positive preventative function against dementia. So it's quite a very big European study has been done with 427,000 people, where they saw people that's got a low vitamin D level has got a 55% increased risk of getting dementia in older age. So that is when the vitamin D levels are low and not treated. So it does play an important part in our brain health, and as we grow older, in preventing things like dementia. Having really good levels of vitamin D can also help us to reduce risk of certain cancers, especially cancers like of the breast, ovarian cancer, colon, non-Hodgkin's, kidney cancer, and endometrial cancer. So that's also a huge benefit that we know can happen if you've got optimum vitamin D levels there. So what's the risk of not having enough vitamin D long term? So for some babies are born with low vitamin D levels, and some do not get enough vitamin D through breast milk, and that can result in things like fits or rickets. So rickets is a condition that affects our bone health and the bone development for children, and it causes a lot of bone pain, poor growth, and soft and weak bones, and can lead to bone deformities. So as you can see from the picture there, so either kind of the bones just don't form or align, and you can get sort of bone legs that kind of bows out or bows in, that can give quite a lot of pain and discomfort for kids as well. Older children who do not have enough vitamin D can also develop rickets. It's not only in babies. Rickets can cause permanent deformities to the bone and weaken muscles and reduce growth. So it does have quite a detrimental effect on children. For adults, the risk of not having vitamin D levels, optimum vitamin D levels, is a condition called osteomalacia. So osteomalacia is the name of a condition where the bones really becomes really soft and weak. This means that they can bend and break very easily. So people with osteomalacia experience bone health and muscle weakness. They're also at high risk of things like a fall and fractures that can really, put a dampen your quality of life if that happens. So how might I feel if my vitamin D levels is low? I do have to say that sometimes people don't have any signs and symptoms of low vitamin D levels. So just to put that out there. But some signs and symptoms that you might feel is fatigue and tiredness. And that I know that can be quite vague because most of us at some stage feel fatigue or tiredness. But if it's ongoing and you are sleeping well and there's nothing else going on for you, then that can be a sign and symptom of low vitamin D levels. Bone pain and achiness, we talked about this before. It's a really throbbing, achy feeling in the bones, and it's especially noticeable in the knees and your back for vitamin D deficiencies. So that could also be an alarm bell really going on. Muscle weakness, so vitamin D deficiency is strongly linked to muscle weakness, especially in our aging population. So where people say that their legs feel quite heavy and it can be difficult to stand up or climb stairs, all of which again puts you at risk of maybe having a fall. Not sleeping well is linked to vitamin D deficiency. Low mood as well. So our body needs vitamin D to effectively make serotonin. So serotonin is seen as our happy hormones, and vitamin D is needed to make that serotonin. So without that, it makes sense that you might feel more low than normal. Hair loss is quite common for people with low vitamin D in their bodies. Getting sick more easily, so it seems like you might catch every cold going. That could be linked to low vitamin D levels as well, that link goes back to that immune system and the role that vitamin D will play in people's immune system. Some people tell us that they have a loss of appetite, so the appetite just isn't as good as it can be, and that can coincide with feeling low as well. And then you might come across looking very pale or drained as well, which I guess fits in with that tiredness and fatigue that people can have if they do have low vitamin D levels. So, but who's at risk of having low vitamin D levels? So we know what the signs and symptoms are, but there is a certain group of people who's more at risk of having low vitamin D than others. So the first group is babies and children and adolescents who spend little time playing outside or being outside in nature, or perhaps wearing sort of clothes for religious reasons that covers most of their body so they don't get that sun exposure onto their skin. And without that sun exposure, their skin is unable to make that vitamin D free, which I spoke about earlier. So therefore, they might have a very high risk of low vitamin D levels. Women who's pregnant and breastfeeding is at risk, and that's why vitamin D is really recommended during pregnancy and breastfeeding. Our older population, people over the age of 65, because their skin just isn't as good as making vitamin D as a younger skin. And also thinking about menopausal women, we know with the lack of estrogen in our body, we already have weakened bones through that. So making sure that we have adequate vitamin D becomes really important in menopause. People with darker skin tones. So we're talking about people from Asian, African, Afro-Caribbean and Middle Eastern descent, especially if they live in the UK, where the weather is so much different from where their origin is. So the dark pigment, melanin, reduces the skin's ability to make vitamin D from the sun, to convert that vitamin D that we get from the sunlight and to use that in our bodies. So people with darker skin tones are at a much higher risk of having low vitamin D levels. And especially then if you tend to wear clothes for maybe religious reasons, and therefore has that extra barrier of not getting enough sunlight on your skin too. If you always cover most of your skin when you are outside, so for some people you might have an allergic reaction to sunlight, or you might not like to be in the sunlight because you burn easily, or like I said before, if there's some religious or cultural reason why you're protecting your body from the sunlight, or from covering up your body, then you won't have that effect of sunlight topping up your vitamin D levels. People who live further north, so where the sunlight is not so strong, would also be at risk of vitamin D deficiency, and anyone who spends very little time outside during the summer. So that could be for a variety of reasons. For instance, people who's housebound, maybe haven't got the ability to go out in the sun. Shop or office workers, so if you're working during the day in an office or a shop and you very rarely see the outside, or night shift workers as well, because they could be sleeping during the day and therefore also not seeing a lot of the sun too. So that's also a risk factor there. People living with obesity are at risk of lower vitamin D levels too. So we know a majority of people that lives with obesity struggle to have a really good vitamin D level. And people with digestive tract issues like Crohn's disease or cystic fibrosis or celiac disease, or for those people who had bariatric surgery, who just aren't absorbing vitamins in the same way after the surgery. So that's all the people who might be at risk of getting a low vitamin D levels. So what is a normal vitamin D level in our body? So this is quite a good chart here. So we know that vitamin D status is not routinely checked by the NHS because there's a cost to it. And sometimes, majority of cases, it might be fine. So a vitamin D status check will only be done in certain circumstances for people. So if you feel that you do have the signs and symptoms of having a low vitamin D level, and you also at risk, so you're in that group of people who's at risk of having a low vitamin D levels, please chat to your doctor to see if they can check your vitamin D levels to just establish what it is at the moment. if that's not positive, or if they don't want to, for whatever reason they can explain to you, there is private vitamin D testing that you can do, but that will be at a cost to you. And I've put in a link there, vitamindtest.org.uk is someone that we would recommend. It's a good source and they do it correctly. So if you feel like your doctors aren't happy to check your vitamin D levels for the reasons that they would explain to you, you do have the option of doing it privately as well. So if we look at the vitamin D levels, so if we look at the red one, so red is where your vitamin D level is below 25. So treatment is definitely needed, alongside monitoring what's happening with those treatments. So if the treatment is effective, and having maintenance doses afterwards as well. So it can't just be a once-off treatment and off you go. So they have to see, did that treatment work? Did your vitamin D levels go up, and what maintenance dosage of vitamin D do you need to take to keep it at a good level? So your GP will decide the treatment plan. It's normally quite a high dose of vitamin D spread out over a few weeks or so, and followed on with some maintenance. If it's amber, so when your blood vitamin D levels is between 25 and 49, treatment really is recommended if you are symptomatic. So if you do have this bone pain, the achy, the tiredness, not sleeping well, low mood, any of those signs and symptoms, and then of course you have to fill it on with the maintenance plan. But optimum or a good vitamin D level is a level between 50 and 74, where that's happy days and probably nothing needs doing from that result. Let's look at sources of vitamin D. A really good source is the sun. So sunshine, I know it's not food, but it's where most of our vitamin D comes from. So in a healthy, well-balanced diet that provides all the other vitamins and goodness you need, you're probably unlikely to meet the vitamin D recommendation through only the diet. You need to top it up with some sunlight. So the amount of vitamin D you make up depends on how strong the sunlight is. So in the sort of winter months, if we're talking between October and March, it's really recommended to take a vitamin D supplement during those times, because the sun's strength just isn't strong enough so to allow our skin to make the vitamin D that we need. In April to September, the sunlight is relatively good. So if you get adequate sun exposure on your skin, you will be getting the vitamin D that you need. So that's the good news. So watch what time of the year it is. And if you can, make sure that you do get that sun exposure, but please be careful and not burn. So don't burn your skin. So be sun safe. Let's look at food sources of vitamin D. There's a limited number of foods that naturally contain vitamin D. Like I said in the beginning, vitamin D is a fat-soluble vitamin, so it's mainly in foods that contain fats. So I've got oily fish on there. Oily fish is a relatively good source of vitamin D. So hopefully you all know that we should have oily fish at least once a week, if you can, twice a week. And there might be a bit of a love-hate relationship with oily fish. So you either hate it or you love it. So do try it in different forms and formats, use different cooking methods to see maybe is there some sort of oily fish that you can tolerate and enjoy eating, and that can lead to an increase of that source. Cod liver oil contains vitamin D, so just be careful if you're pregnant not to take cod liver oil on its own, and talk to your maternity midwifery team to help support you about making sure you're getting the vitamin D you need, but not too much so it can cause a problem during pregnancy. Some food have added vitamin D, or it's fortified with vitamin D, so like fortified margarine, breakfast cereals, infant formula, and yogurts. So that's really handy when you follow a vegetarian or a vegan diet, because you're unlikely to meet your vitamin D requirements through a vegetarian and vegan diet. So it's more likely that you do need a multivitamin or a vitamin D supplement to top you up. And then, of course, the sunshine as well. We do have some meats like lamb, pork, chicken, calf's liver, and beef. So the fat, obviously, in that meat is where that fat-soluble vitamin D is stored and that we have access to when we eat it. And then, like I said earlier on as well, foods like mushrooms and yeast naturally also contain vitamin D. So look out for, if you're vegan or vegetarian, for that fortified products with vitamin D to help you meet your requirements there. Sorry, I don't know why it's skipping so many. So who should take vitamin D supplements, and should you take vitamin D supplements? In a nutshell, I think most people today that lives in the UK should be taking a vitamin D supplement. So there's certain recommendations for it. Children from the age of 1 and adults need 10 micrograms or 400 international units as a minimum of a vitamin D supplement in a day. So pregnant and breastfeeding women and people at risk of vitamin D deficiency should definitely take a vitamin D supplement. The best supplement really is a supplement that's in a capsule form, with the liquid in there is fat. So the absorption of that fat-soluble vitamin from a capsule seems to be much better and much more effective in our body than the absorption of vitamin D through a tablet. So if you have a choice and you're buying vitamin D supplements, if you can't get it from your GP, because you can buy vitamin D supplements off the counter quite easily, but do look out for the ones that's in a capsule form that looks like yellow and shiny, like my picture on there, because it's already in a little bit of a fat emulsion there. What we would say is please don't exceed 4,000 international units unless your GP tells you to, and that would probably be because you're very deficient in vitamin D. So in a nutshell, really do consider taking a vitamin D supplement if you're not already doing so. So just a quick one here about interaction between vitamin D, calcium, and other nutrients. So we call it the vitamin D colleagues. So calcium is absorbed much better in the presence of vitamin D. That's one of the reasons why vitamin D is important for our bone health. But taking too much of both, so taking too much calcium and too much vitamin D, can cause calcium to build up in places where it doesn't belong, like your kidneys or your blood vessels. So that's why there is the caveat of be careful of not taking more than that 4,000 international units. And if unsure, just ask your pharmacists about the right guidance. So rather than worrying about it, the pharmacist is really the person to go to for any queries about vitamins. And vitamin K helps direct calcium to where it's supposed to go, so mainly to the bones. And taking vitamin K with vitamin D may prevent the calcium from depositing into the soft tissue, so it can protect those deposits from happening. Magnesium may help convert the vitamin D to its more metabolically active form. So magnesium is needed to get that vitamin D so our body can actually use it in the right way. Research shows that taking magnesium with vitamin D is more effective at correcting a vitamin D status. So if you have a low vitamin D, if you have a vitamin D deficiency, magnesium helps you much more effectively to correct that deficiency. And vitamin A can prevent vitamin D toxicity and vice versa. Also, some studies suggest that increasing vitamin A can reduce to a calcium buildup that can happen with higher levels of vitamin D. So vitamin A also protects you from not having that unnecessary buildup there. So vitamin D on its own is perfectly fine, but if you can have vitamin D in with other of these other nutrients like calcium, vitamin K, magnesium, and vitamin A, it could be a better way to do it that way. So it brings me to the end of this. So what's our take-home messages? Vitamin D is really essential for maintaining bone health, teeth and muscle health. Exposure of skin to sunlight during the spring and summer is the main source of vitamin D for the UK population. So in the other times when there isn't a lot of sun, like days like today, a vitamin D supplementation is highly recommended. Only a few foods in the diet, like oily fish, egg yolk, meat, it's egg yolk or a whole egg, meat, mushrooms and fortified foods provide vitamin D, and you can aim to include fortified foods in your diet to help boost your vitamin D levels up. Adults and children age 4 and onward really require 10 micrograms of vitamin D a day, or 400 international units. And for children under the age of 12 months, 8.5 to 10 micrograms per day is needed. Or if you buy a vitamin D tablet, just make sure you read the label and you buy it for the right age of your child. Again, asking a pharmacist is a really good plan rather than worrying if you're doing the right thing. We know almost 1 in 5 UK adults has a low vitamin D status. So if you are one of those people who's at risk of having low vitamin D levels, or you do have signs and symptoms that you think this is due to vitamin D, this rings true for me, please go and speak to your healthcare provider or your GP to see, is it possible, taking in consideration your risk and your signs and symptoms, that they will check out your vitamin D status. The government advice is really strong, and that is to take 10 micrograms or 400 international units as a minimum of vitamin D per day. If your GP have advised you to do differently, then of course you follow that advice. And really to take that 400 international units of vitamin D right through the year will not cause you any harm and will make sure that you do not have a vitamin D deficiency in the future. So that really brings me to the end of my my chat. So I'm just looking, there is a question about rheumatoid arthritis. So is rheumatoid arthritis a contraindication to not taking vitamin D? No, actually what they saw is people that has low vitamin D levels are more inclined to get something like autoimmune diseases like rheumatoid arthritis. So if you do have rheumatoid arthritis, taking the 400 international units of vitamin D would still be a really good idea. Again, if you're on certain medication and you're not so sure if that's the right thing for you, if you have got rheumatoid arthritis, because there's a variety of medication you can use, please speak to your pharmacist to make sure that it is safe for you and what is the safe level to take as well, to make sure that you're doing things right.